All right, so we are doing a presentation on, it's called Cycles and Ladders. As you guessed, it's sort of a play off of Snakes and Ladders, but coping with anxiety and avoidance through gradual exposure. So what is anxiety? Anxiety is that feeling of nervousness and worries, and it comes on a continuum that from mild to severe. And as you can see from this slide, that mild to low moderate anxiety can be optimal and healthy. It helps us do things that we need to do that we might not be comfortable doing. It kind of spurs us to be safe. It's like you feel some anxiety when you're about to cross the road. You might feel some, children might feel some anxiety when they're preparing for a test, and that some of that anxiety can help them get motivated to do what they need to do in order to follow through on things. However, anxiety does get severe sometimes, so the higher moderate to severe range, which is too much anxiety, and that's when it becomes what we call maladaptive, and it can interfere with our functioning in life, whether it's at work or at school or socially in any of those areas. This is when there's significant impairment and may lead to an actual diagnosis. So what does it look like? There are physical, cognitive, and behavioral symptoms to anxiety. Physical symptoms, you can feel a flushed skin, your breathing and heart rate increase, and you feel tension in your muscles, a lot of tension, and you might feel some stomach aches, and sometimes with children we talk about butterflies in their stomach. The cognitive symptoms are that you start experiencing difficulty paying attention and concentrating on the tasks at hand. You may have preoccupying thoughts where you're just that kind of stick in your head and can be repetitive. You may struggle to remember things that are going on in your life, whether it's appointments or information. You sometimes have what we call sticky thinking, which means you're perseverating on certain ideas or concepts, and you can't get away from that. You may engage in negative self-talk. You may have worrying thoughts, and you may have flat affect. And every person experiences anxiety differently. And so this is sort of you have some of these symptoms, not all of them. And then behaviorally, you have what's commonly known as the fight, flight, or freeze. So fight is that you might want to fight what's going on there. And with kids, they might actually engage in fighting. But it's also an irritableness and a defiance. You're going to go against what's scaring you. You have the flight flight reaction, which is basically avoiding, and we're going to get more into this through this presentation. And freeze, which is shutting down, and some people can get as much as catatonic, where they just don't move and they just get stuck where they are. Others, and sometimes other forms of behavior are being shy, and we see this a lot in children. They behave very shyly around people they've never met, or in different situations where they feel anxious. And then other behavior symptoms are difficult social interactions, that sometimes we just engage in, have trouble solving problems and things like that, and react negatively. Now, the main concept that kind of drew me to creating this, and Susan to creating this, is this cycle of avoidance. And it's not really a new concept, but I feel in my work with the school board that not all parents know about this. And it's basically the concept that when we avoid what makes us anxious, we will achieve short-term relief from that anxiety. However, that leads to long-term anxiety growth rather than getting rid of the anxiety. What can happen, it doesn't happen every time, but it for sure increases your anxiety towards that thing that you're anxious about, but it really narrows the scope of your life. So for a child or even an adult who has, a child who has school avoidance, or school anxieties and they try to stay home from school. Sure, in the moment they're relieved because they don't have to go to school, but that school avoidance turns into long-term absenteeism and struggles. And the longer you wait, the more in-depth that anxiety becomes, and the student really struggles to get back to school. And so and then for adults, you can even get as far as agoraphobia, where you're afraid to leave the house. And so you can see where that really narrows down your life experience. And so just to break this down a little bit more, so the anxiety is that stimulus that makes us feel those cognitive and behavioral and feelings of anxiety, the physical symptoms. It could be, for children, it could be meeting new kids or being involved in social situations. It could be a fear of a dog. It could be anxiety about tests. For adults, I'm sure you could come up with lots of examples of what kinds of things adults are afraid of. Going to work, approaching their mentors or their bosses, being with other people, lots of things. Those are the stimulus that start us off on that cycle. When we have avoidance, of course, then we are going to not engage in social situations. We may stay away from the dog, from dogs, and avoid tests. Make excuses for not going to school on the test day or things like that. And so, sure, avoiding school, staying home, well, it helps us be calm and relaxed. Talking to a classmate. You're not going to introduce yourself, but it calms our nerves down because you're not going to go involve yourself. If you run away from a dog, you're going to feel calm in that short-term relief. However, in the long term, we don't when we're not interacting with children, or when children are not interacting with each other, they're not learning the social skills that they need to develop as social beings in our environment. We don't learn to interact with dogs. We become afraid of many dogs, and many neighborhoods have dogs and they go for walks every day. And so you will come across them eventually. And so you're going to be constantly afraid of them. And with tests, you won't, tests are a natural part of education, and we need to learn to cope. And that's sort of the point of the cycle of avoidance, is that in avoiding what's making us anxious, we're not allowing ourselves to learn coping strategies so that we can approach those situations and have the best life that we want to have. And Susan's going to explain a few more things, but sort of the rest of this is trying to give you some strategies on how to break that cycle of avoidance.
Yeah, so when we're talking about anxiety and these feelings, whether they're behavioral or emotional or physical, we're talking about our nervous system being dysregulated, right? And as Irene says, it's natural and normal and adaptive for our nervous system to get aroused, to keep us safe, to make us notice that red light, to make us pay attention, to study for that test. But it's when our nervous system becomes dysregulated, over aroused, and it kind of stays there in a prolonged way. And maybe that alarm goes off when it doesn't need to go off. And that's when we get into that too much anxiety piece. So before we kind of get into talking about how to break this cycle of avoidance, we first have to think about how to regulate that nervous system again. Because as long as we're stuck, or our child is stuck in that cycle of fight, flight, freeze, they won't be able to truly connect and problem solve any other way. So first of all, considering how to help your child calm their nervous system. We might try out different things that your child finds calming. It might be maybe taking that big breath together. For a young child, especially, or even for your teenagers, it might be holding them, just kind of giving them your calm, touching them, redirecting their attention to maybe something that is in their control. So kind of grounding them in the here and now might be a strategy. Okay, that's done. Now we're here. It's going to be okay. We solve problems together. But remembering this isn't about avoiding solving the problem. And it isn't about letting your child get away with the behavior. Sometimes we think if we take the time to help our child calm down, then we aren't solving the problem, or we aren't fixing the thing, or we aren't, urging them to, get over it. Because that's kind of our impulse, and it comes from a natural place too. I hate seeing my kids upset. I just want to intervene and tell them it's going to be okay and help make it okay. But remembering, as long as their nervous system is aroused and dysregulated, they aren't going to be able to get to that place of relating and reasoning and problem solving. So the time it takes to help your child calm down and maybe help you calm down will take less time than kind of pushing through that blow up. Go to the next slide, Irene. So we all hope to get our kids to that point where they can regulate themselves, but developmentally they might not be there yet. And remembering that when our emotions are escalated, they simply may not be able to in that moment either. So the thing is, children learn to self-regulate through us co-regulating with them. You might have heard that term before, of co-regulation. This is helping your child calm and feel grounded again, able to connect and relate, and give them that sense of facing a challenge together. One way we can co-regulate and connect is simply by acknowledging and being in the moment with your child. Again, we so quickly want to jump ahead to problem solving and fixing, because it's hard to see them suffering. But then they don't kind of get that sense that we're truly willing to be, present with them and acknowledge that it's hard and kind of validate that. One part of building our children's resilience is also building their emotion vocabulary. So we can also do this by acknowledging and validating some of those big emotions. We can use a skill talked about in this link here by Dr. Dan Siegel, name it to tame it. Through an example that he presents, it's just sort of a minute video, portion of this video. He points out that simply by naming the feelings can start to bring calm and focus to your child. And remember, and you'll see him, you don't have to get it right, but just offering a feeling word can show your presence and your attention, and your child's nervous system being able to calm will just begin to help them move from that sensation or emotion to what we kind of call the thinking and reasoning part of their brain. So go ahead and play that, Irene.
What happens at that moment is, if we did a scan on your brain, we would say that your right amygdala and your limbic area and your downstairs brain, the downstairs brain is super active. I'm scared, I'm scared, I'm scared, I'm scared, I'm scared, I'm scared. And studies show that if you have this kind of presence and of mind, I can get Maria's left brain to name the feeling from the downstairs brain, and you can show that she will squirt soothing neurotransmitters down to her right limbic area, right downstairs brain, and calm it down. Okay, so we quickly summarize that entire set of studies with name it to tame it. So that's all parents need to know. In the book, we didn't put any of this stuff, but everything is backed up by science, believe me.
So what does that look like? I come to you and I have a problem. What do you?
So here's what it looks like. So let's say you're agitated about being rejected by your friends. So I give you the hug. All I'm doing at that moment, I'm not naming anything. You don't jump to that. First, it's connect, and then redirect. So that's, we have these strategies, connect and redirect. So the idea is, first I connect with my right hemisphere. That helps soothe your whole system, but you're still nervous about going back to school. So then I say, well, let's talk about it. And you say, well, this happened, and she was there, and she was going to go to the party, but she didn't want to go, and then they turned away from me. They wouldn't have lunch with me. And I said, sounds like you're really feeling a big feeling of fear that when you go to school tomorrow, no one's going to want to have lunch with you. So we're naming fear.
And I thought I was angry.
And maybe you were angry too.
But it helps to have the
right. But you have to actually name the accurate emotion.
Yeah, I hear that.
Right? Because we could say, well, you're feeling excited to go for popsicles, but that's wrong.
Yeah.
Right? So it's not just naming.
So she always annoys me when she interrupts me there, but it does point out that you might not get the emotion right, but that's okay. It's starting to engage your child in a different way. You first regulated, connected, and then you can help start relating and connecting in a more problem-solving way. So once your child is regulated and in that calm and connected state, then we can think about these different strategies of supporting them to cope with their fears and worries. So this is a technique that is used for managing anxiety, fears, and worries called gradual exposure, or the gradual exposure ladder, because we start at the bottom with our children and we can move our way up to those bigger challenges. And kids get this because who starts at the top of the ladder? So we'll walk you through the steps and then provide an example. So step one would be identifying your child's goal along with them. Maybe making a list of the situations or places or things that they're fearing. And maybe pick one that your child, wants to conquer. Step two would be helping to break that fear into smaller steps, because just, jumping to that top step of whatever that fear they wanted to conquer might be, would be too much. So how to help them recognize there's a whole lot of stuff they can do in between there to make up those steps. So an example might be talking to a classmate, might be something your child feels really timid to do. So different steps might be saying hi, or even just, getting eye contact at first. Make those steps small and achievable. And then another step might be sort of asking them a quick question about, the math quiz on Friday. Another one might be, sharing a conversation. Maybe they're watching basketball and just saying yay about, the basketball team, something they can relate to. So making those steps small, achievable, and coming up with those steps with your child is really important too. Step three is helping your child rate their fears. So when you look at each step together, asking them how much they fear that particular situation. And maybe give a number rating from 0 to 10. 0 might be piece of cake, no worries. They think they could do that. 10 might be imagining really freaking out, having that highest level of anxiety. So a fear, you might even have sort of a fear thermometer that you make up together. 0 is that piece of cake. 1 barely phases you. 2 might be mildly scary. 3 might be starting to get concerned, all the way up to, 6. Okay, my heart rate's, I imagine my heart rate's going to be going. 7 is definitely scary. 8's that kind of big challenge, 10, so you can kind of make that up with your kiddo and make up a bit of a thermometer. And we have resources, and you can find resources, just Google, fear thermometer, and you can find some images for that too. And remember, make sure you don't suggest any judgments with those ratings. It's tempting to kind of contradict them, maybe with, examples. What do you mean that's scary? You did fine with that last time. It's well-meaning on our part because we want to celebrate what they can do and what we know they can do, but we want to make sure we're validating their feelings about this too. So step 4 would be kind of building this fear ladder together. Place each step in order from least to the greatest, and it might take some fiddling, talking through kind of that fear thermometer, making sure they're kind of manageable steps so that they're going to have success. And step 5 would be helping your child actually work their way up the ladder by acting on each step. You might even just act this out, with puppets or with yourself, or, them with a sibling at first. And repetition is really important. Help them repeatedly do the step, even if they feel anxious. And another important thing to even do before you start this is to try out some calming strategies and find ones that work for them. So whether it's breathing exercises or pausing and taking, looking out the window, thinking of some, their kitten, something positive to just kind of get them in that regulated state as they think about even going through this. And remind them to expect to feel anxious. This isn't about avoiding the anxious feeling after all. It's about managing it and finding different ways to respond to that feeling. And it's really important to help your child not judge themselves. we're always our hardest critics to ourselves, and our kids certainly are the hardest critics to themselves. So validate, this is hard. And also, just because they manage the step one day, but don't manage the next, that's okay. That's part of how to expect this to work. And you might even, end up adjusting the latter steps, and that's okay too. And they're not going to sort of get it first time, maybe. And then finally, step 6, once that step feels solid, let reward yourselves. Kind of have a reward, have an ice cream, or have a some kind of ritualistic kind of celebration for that. So next slide here actually has an example kind of for a class presentation. So one step might be, the final step might be how to present that presentation in front of the whole class. That just seems intimidating, impossible. I'll for sure stay home with a stomachache that day because I just can't even imagine it. So then imagine breaking down. So starting at the bottom, we aren't presenting it. We're just researching it. We're just talking about how to create that presentation. And then maybe practicing it in front of a mirror, practicing in front of your stuffies, practicing in front of parents or a friend. I know the teacher would be totally on board with, practicing it in front of them, maybe even by video first. So there might be, different steps in here. And then maybe practicing in front of, trusted friends before you get to that stage of presenting to the whole class. So you can see how these steps might work and look different for each problem and for each child. I'll let you do the takeaways, Irene.
Okay. So you need to remember that you're going to be brainstorming lots of ideas for each step of the ladder. And that means coming up with many different ideas. And this will take time, and it's an important step to make sure we set up the ladder well. And you'll have better options for each step of the ladder after you do some brainstorming, because this will help you think about the fear from different perspectives. You don't need to go through each step of the ladder in one day. This is a plan that could go through multiple days within a week versus even a couple of months, depending on what the fear is and what the different steps are. It's a coping plan that can span a great time, and you would need to feel comfortable before you move on to the next step. Going through the steps on the ladder is hard. You're working on something that feels very scary, and it's completely normal to feel like that, and you can validate those feelings in your child. So just like when you're learning other new skills, this takes lots of practice. So you need to challenge yourself, but remember to take lots of breaks and try to be mindful of your emotions and thoughts. Do lots of mindful breathing. You may need to change some steps of the ladder. As you learn to face a fear, the plan might not work exactly the way you thought it would. There might be a barrier between step 2 and 3 that you need to address before going on to the next step. If things aren't working well, re-examine the steps and the fear levels and see if you can make some adjustments. You will need the help. Children need the help of parents or a trusted adult at school to work through it and help them identify. But ultimately, depending on what the fear is, you may need the help of a professional counselor or a therapist. Some fears are strong enough and have been around long enough that you might need a therapist who's trained in this and many other strategies. So those are just a few things to keep in mind around doing a gradual exposure, or sometimes called a fear ladder, or coping steps, are those kinds of things. So that brings us to some resources. Susan, maybe you could talk about these resources while I put the slide deck in the chat box, and we'll look at the chat box and see what kind of questions we have.
Super. Yeah, we just popped in a few resources here. In terms of at your school, know that there is the SPEC Ed team at the school that wants to support your your child in coping with fears and worries and anxieties. And your support team at the school can support with what we call the larger multidisciplinary team. Each school has a service consultant like ourselves, as well as social workers and child and youth workers that might be able to consult either to the teachers or with a referral directly to families to talk about anxiety, to talk about school-based intervention and classroom strategies, as well as suggest maybe community resources and maybe some groups and that sort of thing too, as well as just supporting in mental health awareness. Anxiety is really normal and common. It's just when it gets really in the way of your child being able to have a good student life that we worry. We have an intranet on WRDSB where we've got some lunch and learns on there, as well as other resources. There's some mental health books here as well that we suggest. Next slide has some online resources and some links there, so you can take a snapshot of that, or it'll be in the link that Irene gives of the whole slide deck. Also, I should say on the WRDSB internet, there's a whole, I think it's an hour-and-a-half parenting your anxious child webinar that was developed by some of us as well.